Good morning and welcome. Before we descend into the maelstrom of the political conventions, we wanted to start what will be a season-long process of bringing you up to speed on some of the very important ballot questions you'll be voting on in November. Among them, question 4, which would allow the use, possession, distribution, and cultivation of limited amounts of marijuana by people 21 years old or older. Here to debate the issue with us this morning are, on your left, State Representative Hannah Kane of Shrewsbury, representing the Campaign for a Safe and Healthy Massachusetts and advocating a no vote. Hannah, welcome.
Thank you.
And Francy Wade, spokesperson for the Vote Yes on Question 4 campaign, and full disclosure, wife of my colleague, WBZ anchorman David Wade. Francy, I have my deepest sympathies and welcome to you.
Thanks, John.
Good to have you here. Let's have you each state your case briefly here just to get this going. We have legal medicinal marijuana and minimal civil penalties for possession of small amounts for personal use. Francy, let's start with you. Why do we need full legalization?
Sure, John. I'm urging people to vote yes on question 4 because I'm a mom and I want to make it harder for minors to get their hands on marijuana. Right now, the CDC estimates that 80% of teens say it's easy to get their hands on marijuana. That's because drug dealers don't ask for IDs. There's no regulation in place, and it's kind of the Wild West out there. What this question would do is create a regulatory commission whose job it would be to put safeguards in place to make sure that there are safe packaging, safe labeling, and that this actually gets out of the hands of the black market. And in addition to that, the reason I also support this is because it would mean $100 million in state revenue that obviously we desperately need during this budget crunch. That money could go to cities and towns. And also because there is a 50-year racial disparity that if you are a black person, you are 3.9 times more likely in Massachusetts to get arrested for possession than a white person, and usage rates are almost exactly the same.
Okay, equal time. Hannah, why is this a bad idea?
It's a bad idea for a number of reasons, John. And, you know, representing the Campaign for Safe and Healthy Massachusetts, we're really a broad coalition, a bipartisan coalition of people who are concerned about this ballot initiative, primarily because it's a 24-page ballot initiative which was written by the marijuana industry for the marijuana industry. The reality is that 78% of people who use marijuana began in their youth. So while I appreciate the perspective of wanting to limit the use by youth, we do not think that this is going to happen under this ballot initiative. The reality is when you have more access to marijuana, you have more youth use. The other issue is that since the 1990s, when there was about an 80% perception of harm among youth in terms of marijuana use, it's now under 40%. So when you combine the access and the availability with the decreased perception of harm, you have many more youth who are willing to try this. In terms of the revenue perspective, most of the revenue that is going to come in is going to have to go to setting up the regulatory environment that is going to need to exist in order to bring this legalization in. And finally, again, to the issue of the minority, you know, again, that's a concern. Largely, when we decriminalized, we took a lot of that away. And in effect, what we're seeing in Colorado is there's actually more minorities being arrested now than there were before they legalized marijuana there.
All right, we need to take a short break. But when we come back, let's get into a little bit more rebuttal and crosstalk on this as we explore the arguments for and against question 4, full legalization of marijuana in Massachusetts. Please stay with us. Welcome back to our discussion of question 4 on your November ballot, the marijuana legalization question. We're talking with Francy Wade for the Vote Yes side and Hannah Kane opposing the measure. Former Congressman Patrick Kennedy, who's one of the nation's leading mental illness policy advocates, is adamantly against this, Francy. He calls it a windfall for big business. And the single biggest threat to America's mental health, end quote. What's your response to that?
Well, I think that, you know, with all due respect to Mr. Kennedy, there is actually no proof that marijuana leads to opioid abuse. The only time we hear this is when people are trying to politicize this and when people are talking about legalizing, regulating, and taxing marijuana. In fact, there was just an article that Kay Lazar from the Globe wrote last week that pointed to the fact that in states where marijuana is used medicinally, the prescription rate for people who are prescribed pills for things like anxiety, depression, and other things has actually gone way down. $165 million has been saved in writing prescriptions because people are being prescribed marijuana. And it's actually the exact opposite. It doesn't lead to the opioid crisis. It can actually help alleviate it.
Rebuttal, Hannah?
I just think this is the wrong path and the wrong time for Massachusetts to be legalizing marijuana. We are spending enormous resources, both in terms of financial resources and time. And if you talk to anyone who is in the addiction community, they will tell you that legalizing marijuana will lead to more problems for
So
them.
our campaign manager,
Not every single person who becomes addicted to opiates certainly got that way because of marijuana.
That's
but
right.
There's hardly anyone who is in treatment for substance abuse disorder who is not also a marijuana user. And so the opportunity to bring this forward now at a time when we already are struggling as a state to deal with the opiate addiction, it's the wrong time.
That's
Why would
exactly
we
my
on one
point.
hand be saying we should be, we're fighting
politicizing
opiate.
it.
On the other side, why would we want to legalize it at this time and have youth have more access to something which we know is harmful to youth?
Go ahead. You're
This is a
trying to make a
wonderful
point there.
platform for politicians like Representative Kane to politicize the opioid crisis. You never hear about people saying anyone who tries marijuana becomes addicted to opioids. That's just not the case.
I don't think that this is a politicization of opiate addiction. Quite honestly, there are a number of us who have worked very hard at fighting this. And the Mass Medical Society, the Massachusetts Hospital Association, business trade associations, nurses, doctors
Why are we
are all
cutting the budgets then for the
they're
opioid
all
addiction
combined saying that
Just
we
cut
should
that
not
this
be
week.
legalizing marijuana. And I think, quite frankly, I think that the proponents are trying to move the discussion in a way that confuses people. What we should not be confused about is that when you legalize marijuana, youth use goes up. And
That's
that is
actually not the case.
something. It is absolutely the case. And all of the states who have the highest youth use are the states in which you have had legalization occur.
Colorado Healthy Kids study just came out this year that proved rates have stayed exactly flat among teen use. Governor Hickenlooper
that
of
study
Colorado
actually did not take
Governor
into
Hickenlooper
consideration-
of Colorado.
One at a time, please.
Governor Hickenlooper of Colorado, who was a staunchly against the initiative before it passed, has now come around and said
Okay.
that actually we're generating revenue in our state and it's keeping
What he said the
marijuana
other
out
day
of the
was that
hands
any
of
state
students.
considering
Final word, please.
legalization, The
Go
governor
ahead.
of Colorado actually said the other day that any state that is considering legalization should wait and see what happens here in Colorado and not do it at this time.
We're just getting started on this discussion. I wish it could continue, but my time is up. Very quickly, a website people can go to find out more about the positions you're taking, Hannah Kane.
safeandhealthyma.com, and we would encourage people to go there and learn more facts about the initiative.
Thank you for being here, Francy Wade.
And regulatemassachusetts.com.
Thank you both.
Thank you.
Appreciate it. And hopefully we'll get more opportunity to discuss this as the campaign rolls on. And a reminder, coming up all this week here on WBZ, wall-to-wall convention coverage. Paula Eben is going to be in Cleveland covering the GOP convention. I'll be here watching it the way you are on TV and analyzing what's coming out of that podium. Hope you'll join us every night on WBZ News at 5, 6, 10, and 11. That's it for me. Now back to my colleagues for more WBZ News.